Hello. Thank you, Mary Lee, and the members of the council. My name is Jennifer Ring. I'm the Director of Business Development for Methodist Hospital with Dignity Health. Methodist Hospital is the local affiliate of Dignity Health. Between Methodist Hospital, our 6 sister facilities, we have well over 1,200 beds here in the greater Sacramento area that have been serving the community going back to the very first hospital that was built in the greater Sacramento area in 1896. We have a very long history of rendering healthcare services, and today we stand to be one of the largest providers of healthcare services to the city of Elk Grove. Between our affiliates with Mercy Medical Group, Methodist Hospital, Mercy General Hospital, Hills Physician Network, and the United Surgical Partners. I'm here today to affirm our commitment to build a hospital here in Elk Grove. Our current plans are to build that hospital on our 28-acre site where we currently render outpatient surgical services and have several physician offices on the corner of Weinmark and Elk Grove Boulevard. We intend to build a hospital that will be at least 100 beds, likely more. The services that we intend to provide include emergency services that we believe will meet the needs of the Elk Grove community. We intend to provide women's services, general medicine services, surgical services, orthopedic care, geriatric specialties, and we continue to be a teaching hospital. We today are a residency program where we are currently teaching physicians on family medicine providers. I currently am in charge of the bed needs assessment. I've spent well over 2 years studying the healthcare dynamics in the city of Elk Grove and can attest that we are building a right-sized hospital for the city of Elk Grove. We invite the council to ask a lot of really serious questions of any proposal of building a hospital in the city that will address key dynamics of healthcare services that include the managed care environment that is continuing evolving, the competitive environment of all the different healthcare providers that are already rendering care, the dynamic of the fact that today the use of hospital services are actually diminishing in favor of more ambulatory services. We also invite the council to seek information on the actual health status of the community of Elk Grove and what are the necessary services. Dignity Health is happy to provide these in for anybody who's willing to ask. Thank you.
Okay, thank you. Good evening, Ms. Blatz. Welcome.
Thank you, Mayor Lee and council members. I am Phyllis Baltz, and I work with Dignity Health, and I serve as the hospital president at Methodist Hospital, which provides services to our community in Elk Grove. We're very proud of that commitment. I would like to emphasize my colleague's prior comment, Jen Ring. We've officially announced earlier this year our plan, and we will be building a hospital in Elk Grove community. So Elk Grove, I'm so pleased to hear the request for a hospital facility in the community, and that will happen. I do want to affirm that we have the entitlement on our 28 acres that we own near Elk Grove Boulevard off Weinmark, and it is zoned and approved for medical campus, and we will be building phase 1. We have done some diligent study of the needs of the community, the trends of health care, and we are a proven and trusted medical provider for acute care services and also for significant outpatient services. So we have planned accordingly for those needs for the Elk Grove community. I would also like to emphasize that we are a teaching hospital. We are a medical residency program for family medicine residents. So we do have that reputation as well. Our commitment from our corporate organization and board is to officially have our architectural documents submitted to OSHPD. That is a process of approval through OSHPD. It likely could take a couple of years. That's the same process that all hospitals would have to go through, but we're in a position where we have the land and we can design to that building and we know what we can do. So we would submit that and then upon approval from OSHPD, begin construction. So we're factoring all that timeline. A standard process from today to opening our doors would be about 6 to 7 years, and that's when we will be bringing the hospital to the Elk Grove community as a phase 1. We do employ over 1,200 employees, over 400 physicians, so that's a significant move of opportunity that will come to the Elk Grove community with this new hospital. I appreciate the opportunity that I've had individually to meet with Darren Suen and educate him on bed need analysis. He was very thoughtful in his request. I'm sad to not see him here this evening. And also Mayor Lee and your visit to our hospital, very much appreciate that. And just want to affirm that we are designing to meet the needs of the community, and our commitment to Elk Grove is to meet that growing need, and hence our official announcement of our plan to build the hospital. Thank you.
Thank you, Madam President.